Good evening, ladies and gentlemen, my distinguished panelists and the esteemed viewers. A very warm welcome to this insightful session on the occasion of Breast Cancer Awareness Month. Powered by Pfizer, we are organizing a virtual series by the title Empowering Women, Breast Cancer, Health Education, Signs, Symptoms, and Self-Examination. And our theme of this particular session is Pink is Stronger Than You Think. So I welcome all my esteemed panelists here. I'll go one by one. I have Dr. Bharath Rangarajan, consultant medical oncologist, hemato-oncologist, and stem cell transplant physician, KMCH Hospital, Coimbatore. Good evening, Dr. Bharath.
Good evening. Namaste.
Thank you. We have Dr. Ventrapati Pradeep, consultant medical oncology, Apollo Hospital, Visakhapatnam. Good evening, Dr. Pradeep.
Good evening. Good evening.
We have with us Dr. Satheesh, Consultant Medical and Hemato-Oncology, Director of Clinical Trials, HCG Cancer Center, Bengaluru. Good evening, Doctor.
Good evening. Namaste.
And we have with us Dr. Jatin Sarin. He is Director Medical Oncology, IV Hospital, Mohali, and Director CCDC, Chandigarh. A very good evening, Dr. Sarin. I think Dr. Sarin has just hopped off the call. So I think we'll start with our discussion and we'll have Dr. Sarin join us. So to start with this conversation, I'll start shooting a couple of questions about the signs and symptoms of breast cancer. What are the different modes of diagnosis we have in the market? Some common misconceptions that we'll burst, and we'll talk about encouragement and awareness around it. So I'll start with Dr. Bharath. My first question with you will be, what are the common early signs and symptoms of breast cancers that every individual should be aware of? Please, sir.
Good evening. Before we start, because I am the first person to whom a question is addressed, I'd like to start by congratulating you on this wonderful initiative, because more than anything, I think that the month of October is celebrated as the breast cancer month because we need to spread awareness about breast cancer, and this awareness starts by women not being afraid, women not being shy, women not being able to come out with their symptoms with respect to breast cancer, and that I think is the most important thing. The women feeling more confident about their breast health, that breast health is important, and they need to speak about it. I think that's the most important take home from this initiative. And jumping on quickly to the breast cancer early signs and symptoms, the most common symptom that a woman reports that we see is a painless breast lump, especially a newly appearing breast lump. The important word here is, in early breast cancer, the lumps are painless. So absence of pain should not make anybody ignore a breast lump, especially a newly appearing breast lump. Now, other than this, it may not appear as just a lump. There may be a difference in the contour of the breast, or thickening or a swelling of one part of the breast, or a skin over one part of the breast, which may not really feel as a lump, but as a difference in the consistency or a difference in the contour of the breast. So everything is not always a lump. Now, other than this, an important sign is, if there is sudden appearance of nipple retraction. This is something that is sometimes missed, especially in many women. And if there is a sudden new onset nipple retraction, that is the pulling in of the nipple, then the woman should address this and go to a doctor. Rarely you can have sort of orange skin appearance, that is the skin showing edema, that is edema means fluid collection beneath the skin, which leads sort of small dot like appearances or small pit like appearances like the orange skin on the skin of the breast. And other than this, any nipple discharge, especially a bloody discharge, though rare, also it should encourage a woman to go to a doctor. And sometimes lumps appearing higher up in the armpit or higher up towards the axillary area, what we call the armpit area, could be one of the early signs of breast cancer. Please remember that any of these signs may appear in other diseases also. You need not be scared that every lump in the breast is a breast cancer, but every lump that appears needs to be seen, assessed, and evaluated by a trained medical professional.
Right, sir. Thank you, Dr. Bharath, for establishing a good foundation to this particular awareness conversation. Moving on, I'd like to ask a question from Dr. Pradeep. So, Dr. Pradeep, how do these signs and symptoms that Dr. Bharath just mentioned vary across the different stages of a breast cancer? And please emphasize on the crucialness of early detection in breast cancer, please.
Yeah. So as Dr. Bharath mentioned, so usually in the early stages, usually the symptoms are what actually Dr. Bharath mentioned just now. So when we are saying stage, first it is important to understand what is a stage. Okay, so by stage, what we are trying to tell is where is the tumor present. So for example, if the tumor is only present in the breast, so we usually say it is stage 1. Maybe if it spreads to the axilla, into the armpit, so it may be stage 2 or stage 3, but it's still stage 2 or stage 3. But once it spreads outside the breast and the armpit, like it can spread to the lungs, the bones, the brain or the liver, usually then it becomes stage 4. So usually the symptoms depend on the stage. So as long as the tumor is present only in the breast, probably in the first or second stages, usually, then the symptoms will be what we just heard or discussed. Okay, like it may just be a painless lump, or it may have, I mean, there may be some amount of nipple discharge. Okay, sometimes the nipple may be retracted, or sometimes if it increases in size, it may also cause pain. Okay, and the mass also may eventually become very hard. Or the if it goes to stage 2 or stage 3, then the lady may experience also different swellings in her armpit also on the same side usually. Now once it spreads outside the breast and goes to a different part of the body, then the respective symptoms according to the site of the disease start coming up. Like if it comes in the bones, okay, it spreads to the bone, then the patient may start experiencing some pain in the bones, either in the back or wherever it spreads. Similarly, if it spreads to the lungs, so she may have cough, okay, or she may have breathing difficulty. And similarly, if it spreads to the brain, then she may have some headache or instance of seizures. Usually these symptoms are usually seen only in the last stage of the disease. And so it depends where the tumor is actually present. But the most important thing is, once it spreads out of the breast, it becomes difficult to cure the disease. So that is why we emphasize on early detection. So our target is to detect the tumor when it is in the stage 1 or stage 2 or stage 3 itself, because that is when we have a chance of completely curing the disease from the body. So it is very important that the tumor should be detected when it is still present in the breast and it has not spread out from the breast.
Thank you, Dr. Pradeep. Thank you for your insightful answer. Moving over, Dr. Satheesh, I'd like to put forward a question to you that many women in their general life will experience various changes in their breasts during menstrual cycle or life stages. So how do individuals distinguish between normal cyclical breast changes or maybe the potential red flags that will require ultimately a medical attention? Please, sir.
Yeah. Thank you for a good question. It's a normal confusion. Okay, like every woman, they'll have that. Okay, every month they'll have a cycle, they'll have a like normal physiological, means is a normal routine for every woman. They'll face this before the menstrual cycle start. They'll feel engagement of the breast, they feel heavy discomfort, and once after the menstruation has started, the pain and even swelling discomfort will start coming down. This normally it will happen actually for it is going to all women is going to face this. See that that is most important is the woman should aware of what is normal for them. And even they'll have some small feel like especially 20 to 40 years, the physiologically that cyclical variations, they'll have a normal physiological changes, and small like cystic changes and fibroadenoma, their physiological lumps will tell. But they should know what is normal for them. But what Bharat really pointed out, it should be, if we found any point of time that a lump is noticed by any woman, at least you have a medical professional should have an examination once, at least make sure that is a benign or something else. It need not be cancer at all. Like it can be other like a lump, it can be like infectious, non-infectious, other lump can be there. Make sure that at least once medical professionals examine. The normal physiological changes, what I said is normal, that before menstrual cycle symptoms and after menstrual cycle, these symptoms is going to come down. But women, they feel that the persistent lump, that swelling, that is it is not coming down. They face that like the swelling is persisting, and the pain is not coming down. It can pain can be because of the inflammation. The Bharat has told like various signs and symptoms, like what it clearly is alluded excellent, like that one. You can pick out any woman in the normal layman language. He has explained everything. At least if you find that like that any that duct is blocked or cystic disease inflammatory is there, they might face a pain. Otherwise, like skin inflammation is there, they might face a pain. Otherwise, like usually is a painless lump will be there. The skin changes, the structural breast variation of size of the breast, they might feel that compared to opposite breast. Because the women's supposed to aware of the what is normal for them. That's why it's important. Education of all women is important. They are to practice that at least by standing in front of the mirror. Okay, just okay, what is normal for now? Is it like breast is both the sizes are normal, shape is it is okay, and it see it maybe physiologically can have a slight variation of size can be there for each woman also. Can be that they should be know that okay is normal for me. And if you find that it is like okay compared to previous one, like because you should not be upset that okay some changes is there, okay so suddenly I should be visit. Okay, persistent like some lump I'm feeling that is not coming down. Like it can be physiological. I said about before menstruation, you feel like slightly just before the menstrual cycle, you feel like heavy pain, discomfort. You feel like a lump like feeling can come actually. It will come down. Oh, and then after that is like not coming down, then definitely I should consult a medical profession. And other signs and symptoms, I think that Dr. Bharat has explained that you should aware actually. Okay, thank you.
Thank you, Dr. Satheesh, for such an educative and an insightful answer. I am sure this helps our audience understand it better. Dr. Jatin, my next question is for you. So, this question is: how important do you feel is it for individuals to recognize these subtle or maybe unusual breast changes, and how important
Hello.
it is for them to speak it out to their healthcare providers? And let's say tell the steps that one should take if they are noticing some signs and changes in their breasts. Please, sir.
Hello. Can you hear me?
Yes, sir. You're audible. Yes.
Can you repeat the question for me? Actually, my internet connection is unstable, unfortunately.
No problem, sir. No problem. I am talking about the importance of recognizing, let's say, an individual recognizes their early symptoms. How much is it important for them to tell it to their healthcare providers, and the steps that one should take once that they notice something unusual? A message out to the females. Over to you, sir, please.
Very important, actually. Well, that is actually the important outcome of cell breast examination, which is an important reality, especially in the Indian settings, to identify the changes and report it immediately. Don't hesitate to report even the smallest or even the minutest change they have in their the females have in their breast, and they should come for clinical examination They should go for, if advised, go for mammogram or ultrasonography, or and then go for an FNAC, that is fine needle aspiration cytology if required. And mostly these like 90% and more are usually benign, but there is always a fear psychosis in between female. If there is
I think we're seeing
perform
some.
the examination or
Dr.
hello.
Jatin, your internet connection seems to be a little unstable, unfortunately. Your voice is breaking in the middle.
Uh,
Okay, we'll circle back to Dr. Jatin. My next question is for Dr. Bharath. As just described by Dr. Jatin about the diagnostic methods that are
is it
available.
is it fine now?
Yes, sir. Yes, sir. We'll circle
Yeah.
back to you on the next question
So
eventually. Yes, sir.
sure,
If that
sure,
is okay.
sure.
All right, please. Yeah, Dr. Bharath. So I want you to describe about the recent advancements in the breast cancer screening technology that we are seeing, and how have these advancements enhanced the accessibility for, let's say, the underserved communities that we have.
Um, that's a very, not the question. The answer to that question is not very simple.
Mhm.
Primarily because you're specifically asking screening. Now, when we say screening, we always the population is a healthy woman, a woman who does not have any symptoms, a woman who is, just a woman in her house or a woman on the street without any problems. We are screening her for disease. Now, we have to establish who is a woman who needs a screening. So there are some controversial areas which I don't want to get into. Each expert has very strong opinions on who should get screened and who should not get screened. But suffice to say that definitely women over 50 years of age who do not have any symptoms are candidates for screening.
Mhm.
Now, women between 40 and 50 years also may be included in this bracket for screening, especially in countries where breast cancer incidence is going up. And yes, it is also going up in India, and India now has breast cancer as one of the uh, largest cancer diagnosis in women. So now, what do we do to screen? I would say before we talk about technologies, we need to understand that the most important thing, as I stressed first, is awareness. Women should be, they should be empowered enough. They should be, have the opportunity or the platform to be able to come out and discuss their breast health. And amongst this, the first thing is, of course, a self breast examination. Already people have spoken about it. That is very important. Self breast examination every month. Extremely good YouTube videos are available on how this has to be done in front of the mirror, in the shower, in the lying down position by the woman. And these videos are very educational. The woman must do it at least once a month, preferably around 7 to 10 days after her menstrual cycle has started, 7th to 10th day of the period, or at least 10th day of the period, or beyond that. Now, other than that, any woman who goes to a doctor for any purpose, especially if she goes to gynecologist, any other doctor, should get a physician breast examination, or at least a questionnaire, whether she is examining herself and whether, she has noticed any lumps or changes in the breast. And physicians should be encouraged to do a breast examination. This also sort of makes the woman aware that, that they have to be careful about their breast health. Now, thirdly, the most important method that is used is, of course, the digital mammogram. The digital mammogram will detect early lesions less than 1 centimeter in women who are otherwise asymptomatic. Now, screening is different from women who have already come in for a breast lump evaluation. So the digital mammogram is there, and digital mammogram definitely stands the test of time as the method of screening. There are other methods like sonomammograms, where you use an ultrasound, or an elastography, where you use the compliance of the tumor to the breast tissue. There is now a newer modality in the mammogram called the contrast enhanced mammogram, which actually is extremely good and picks up very early lesion. And lastly, the MRI mammogram, which can be done. Now, in spite of all these new modalities, that is from the sonomammogram, elastography, contrast enhanced mammogram, MRI mammogram, the digital mammogram still stands the test of time as the test to do for screening, especially for asymptomatic women in the public. Except when we are talking about women who have got a genetic predisposition to develop breast cancers, which include, but is not complete list of, the BRCA1 and the BRCA2, the famous genes. There are many celebrities who have had these genes. So if there is a BRCA1 or a BRCA2 gene in the woman, then these women are recommended for screening with MR mammogram and a digital mammogram alternating. That is, they are recommended once in 6 months screening, one time with an MR mammogram, the other time with a digital mammogram. And of course, more diligent self breast examination and physician breast examinations for these women, because they are at a higher risk and you want to detect the tumor when it is very, very early.
Thank you, Dr. Bharath. Thank you for talking about the different screening methods. Moving over, Dr. Jatin, I hope your internet connection is a better stability now. My next question will be for you, building on what Dr. Bharath just talked about. How do genetic and hereditary factors influence the risk of developing breast cancer? I'd like you to give some answer for that. And how do you feel that this impacts the screening and the prevention strategies that we have for high risk individuals? Over to you, Doctor.
Definitely. Yeah. So around 5 to, am I audible clearly now?
Yes, sir.
Yeah. So around 5 to 10%, rather, I would say just 5 to 7% of breast cancer are genetic. And the two very important genes, which many of the people would be aware of, are BRCA1 and BRCA2 genes. And other than that, the family history, as other panelists have told before, is very important. But the presence of family history does not always imply that it is a hereditary breast cancer. The pure hereditary breast cancer is when your previous generation or the generation before is also suffering from breast cancer or related diseases. So the important genes, as I said, are BRCA1 and BRCA2. So BRCA1 and BRCA2, if BRCA1 especially in breast cancer has a lifetime, the person carrying BRCA1 gene has a lifetime risk of around 80% of getting a breast cancer. So that is a very high risk. And in those individuals in which such a risk is present, usually it is later on when a person contracts the disease, unfortunately, then you go and test for it. But if someone is lucky enough and their mother or anyone else, their cousin or anyone else in their family have been tested, and they also have that particular gene positive in their body, then that screening part is very important. The screening means, first thing, that there should be a proper genetic counseling, and they should be given all risk reduction strategies. Well, the screening for a BRCA positive breast cancer is different as compared to the ones whom the family history is of early or younger age breast cancer case in the family is concerned. Because as my panelists have said, the screening usually starts from the age of 40 years and above. But in family histories, if there is a case which is say 35 years, she had a breast cancer at around 35 years, the screening for the females in that family should start 5 years earlier or 30 years or so. So that is an important thing. And for BRCA positive, the screening should be so intensive that it involves not only mammography. People should go for a opposite breast MRI scans every 6 months. Otherwise, they can go for a risk reduction mastectomy, and the mastectomy in which not a single cell of viable breast tissue should be there. Otherwise, there remains a chance of getting a breast cancer. So that is how, for an average risk, you start. There are guidelines for screening starting from 40 years of age in India. But for other modalities of screening like self breast examination, any female above the 20 years of age should do self breast examination. Well, this is for an average risk in which there is hardly any family history, or a family history in which their family members had this particular disease at 50, 55 years of age. Otherwise, in high risk individual, they should start getting screened at an earlier age.
Thank you, Dr. Jatin, for that elaborative and insightful answer. Building on what Dr. Jatin just spoke of, my next question will be for Dr. Pradeep. So, what role does breast self-examination play in early detection, and how does it complement the regular screenings and the clinical examinations done? I'd like you to put a few words
Yeah.
on that, please.
Yeah, thank you for the question. So, as Dr. Jatin said, we usually do a mammogram, once a year, or an MRI once in 6 months in high risk individuals. So, obviously, these modalities require the patient or the woman, as I say, to come to the a hospital or a screening center or diagnostic center to get all the things done. Okay, so obviously it takes some effort and on financial constraints also. So self-breast examination is something which is very easy. It can be done by the woman herself at her home with her privacy. Okay, it doesn't require much of an effort. Though if we look at the data, the self-breast examination may not have increased the chance of detection, but it will help us to detect the interval cancers. So, for example, we are doing mammogram once a year. Okay. So, what if tumor, starts within after the mammogram has been done, and and by the time the next mammogram happens, it has grown to a significant size. So, to detect these interval cancers, this self-breast examination will help the woman to come to the doctor.
Right, sir. Thank you for that good answer. Moving over, my next question will be for Dr. Satheesh. Like our different panelists have already spoken about the various screening methods that are available for detecting breast cancer. As a clinician, I would like you to tell, how do you make a diagnosis once that a patient has reached? What are the different diagnostic methods which will help you conclusively confirm that it is a breast CA? Please, sir.
Yeah, thank you. I think my colleagues Bharath, Pradeep, and Jatin, they have said about what are the various modality of screening test and self-examination. They are emphasized on that. See, any woman you found that lump is there, I want to confirm that is a breast cancer. If mammography is not done, we are supposed to do it, because why it, like, even though already lump is there, it makes sure that okay, it is a lump is benign or a malignancy is there. That is one thing, is make sure that assuring that okay, looks like abnormal lump. That is a one thing. And also is that is a one lump is there or a small multiple lumps surrounding that multicentric disease or not. The lump is a breast tumor is confirmed by the additional test, like the diagnostic ultimate is a pathology, means tissue diagnosis. You have to take a small tissue, and usually previously we used to do needle FNAC, if needle aspiration. Now we are not doing that. We are trying to do the small chunk of tissue is taken, that is a two-cut biopsy we say. By doing this, like we are able to take collect some small tissue, we are able to confirm it is a cancer or not. Okay, one thing. Once you confirm that, we try to do additional test, that is the receptor test. that is a ERPR, that is a hormone receptor status, and HER2. These are the receptor status we'll see, and also grading. The histopathology we are going to assess, that is a low grade, high grade, that's grading, grade 1 or grade 2, grade 3, that's what. And also is going to come to know that is a K67. These are simple basic for like the marker. We are able to categorize into whether it's a luminal A, slow growing or fast growing, then the various other triple negative or HER2 positive. These kind of things we are going to biologically we are divided into different basket. Okay, this is one of the pathological confirmation. Then other thing is we try to, I think that colleague has said actually based on the age, family history, like a high risk is there, we try to see that triple negative. So many times.
Dr. Satheesh, I think
Triple
we just
negative.
lost your connection. Yeah, you're back.
Yes,
Please
sorry.
continue, sir.
Yeah, yeah. Based on the age and also subcategory of the biology of the disease, like we try to do molecular test in the form of the genetic test, hereditary high risk family history is there. We try to do that BRCA 1 and 2. Now, like some of the like if history is there, not only these two genes, even other hereditary gene also, hereditary germline mutation also. If we do that, is a added benefit is there. Other genes also may be contributing that that will be added benefit. And also now, like if it's a triple negative breast cancer is there, we try to do PDL1 is one of the marker. It is now the newer therapies are available along with the conventional chemotherapy. We try to add a immunotherapy also. These are the additional newer test what's where once we confirm the cancer is like that. This is the some the tissue based test and blood based test. Once you confirm that okay, because the suspected by the clinical examination, mammography, and we found that tissue is confirmed, and the staging also is important, that what the kind of treatment, whether is a localized, the Pradeep is a told staging, whether it's a limited to the breast or like other than like it's a spread to the armpit to the axillary gland, or like it's gone beyond that. Okay, that is a whether it's a stage 2, stage 3, or stage 4. For that, imaging will be done. Then we used to do CT scan and bone scan. Some of the like the institution they're having advanced like imaging, the PET scan is also available. That can be this modality can be utilized for the staging. Once the stage is confirmed, whether is the stage 1 or stage 2 and the stage 3 or stage 4, then based on that one we try to the decision make. It is the combination of surgeon, radiation oncologist, and medical oncologist. All the multidisciplinary discussion will be done whether you have to go, because the based on the biology with the less aggressive disease, whether I to limited to breast, I'll try to go surgery. More aggressive disease, we may have a chemotherapy like or even a targeted drug is HER2 positive is there. We'll try to have a combination of targeted therapy and chemotherapy, shrink the tumor, then we try to go for the surgery. It is a combination of multidisciplinary team. We try to decide what kind of nature of the treatment we have to initiate first, and when, and the next what is the plan. Like these are things will be discussion will be done. Based on that, we are going to execute what are the treatment policies. Yeah.
Okay. Thank you, Dr. Satish, for that well built and elaborative answer. Thank you. Moving over to let's say busting a couple of common myths that are around there. My next question will be for Dr. Bharath. What are some common misconceptions and fears that the women often have regarding breast health? Uh, and how can you, as a clinician, how can we, as a platform which creates awareness, how can we basically dispel these myths and encourage proactive healthcare practices? Dr. Bharat, over to you, please.
There are so many myths, and each geographic area, each social, cultural women from each social and cultural background will have one particular sort of thought process. But to begin with, in diagnosis, the first myth is that absence of pain means absence of cancer, which is not true. If there is a breast lump, painless or painful, the medical attention is necessary. So that's one of the first myths. Painless lumps should come for medical attention. Now, the second thing that many women assume is that a biopsy actually results in if it is a cancer, it results in the cancer spreading to the other parts of the body. Now, this myth has to be disabused very, very strongly. It is the nature of cancer as our doctors have said, Dr. Pradeep actually elaborated on symptoms, on stage wise. So every cancer moves stage wise and spreads from local to the lymph nodes to the other parts of the body, and that is a natural biology or natural progression and not related to the biopsy. And biopsy is very essential, as Dr. Satheesh said, for doing a lot of tests and planning treatment. So that's the second myth that's very important, that we need to disabuse women of. Then the third thing that women have is breast cancer. Every cancer is not curable, and so what happens is when they get a disease, when they get a lump, they fail to come to medical attention. So uh, the here education is very important, where they are taught that early lumps, any early symptoms, they should come in early, because early breast cancer, as of date, with proper treatment, in stage 1 the cure rates surpass 90% or even higher, and even in stage 2 and stage 3 you can get a cure rate of anywhere between 60 to 80% with proper treatment. And uh, even with breast cancer in stage 4, more and more women are now alive for 3 years and even up to 5 years with proper hormone therapy and proper targeted therapy and proper immunotherapy delivery. uh, so that's a myth that a cancer diagnosis means death. It is not. Early cancer means cure for majority of women. And even metastatic disease, that is stage 4 cancer, which has spread, we could give women many many months of very useful, very fruitful life with very good quality of life. Which comes to the fourth myth, that treatment means fall in quality of life. It actually is the other way. Proper treatment actually means overall improvement in quality of life. And this is something that patients, women, attender, everybody needs to understand, that you treat properly, you actually have improvement in quality of life. So this is regarding with diagnosis, with biopsy, with treatment. Now, there are some other myths which are very important. The social myths, that cancer spreads from one person to another. If a woman has cancer, she has to be isolated. People do not interact with her. They do not share this utensils, vessels. They are, socially isolated. They are not allowed to use the same restrooms or bathrooms or toilet facilities. And they are psychologically, emotionally, and even physically isolated from family members, from children. So that also needs to change, where we need to say that these diseases are not do not spread from one person to another. And that has to be emphasized. And lastly, one of the myths, that is, Dr. Jatin very specifically mentioned, around 5 maybe 7% of cancers are hereditary. So it does not mean that everybody is worried that one person has, everybody in their family is going to get again a breast cancer or every other cancer. It just means that people have to be more aware, more diligent about follow up and screening and everything. But it does not mean that everybody in the family is now at a risk of developing cancer. So with all this, you asked how to promote through this platform. Of course, we keep at least in the month of October and in other months also, we keep delivering this message to people. And I'm sure slowly it is a trickle, it'll form a stream, and then a huge river of information, and it'll reach people ultimately.
Thank you, Dr. Bharath, for your insightful answer. Moving over to Dr. Satheesh, if you'd like to add to any myths to what Dr. Bharath had already mentioned, first of all.
I think Bharat has covered maximum. Uh, there's the other thing is like the few things actually that because other thing additional my additional field is clinical trial. This is a clinical trial, one of the option, like it need not like that the best option to the standard treatment existing also is available. Clinical trial means that they try to as a they use as a guinea pigs. because this is one of the myth is there. Like, see, that was a hold of thought, all those things. Like, see, it is all the protocol, how it will be delivered, and it is ethical committees, their decision. It is the is going to harm anything. It is going to be inferior treatment. All those things that the decision will be done is not going to use as a guinea pig. That will be the standard, or even maybe new experimental treatment can be added to the current standard treatment. It can be even superior result can be there. This is a process. That's the one thing the clinical trial related the myths is there. And other thing is, see, when the stage comes in end stage, like we might depend on the lot of painkiller. We might go for the that consumption of painkiller. We may go to the opiate drug, morphine, all those things. So people they think that using morphine, they feel like addicted with the drug. And those. It's not like it is having a short few hour of that the power of that pain control, and it can, that is one of the thing they'll feel addicted. Not like it's going to control the pain for hour. It's not like not like is how the drug addict they'll become those things like withdrawal symptom won't be there. The withdrawal symptom won't be there. Here the pain they're experiencing that is going to give for the pain control. That we are in a situation we are not going to have any active cancer. At least where pain management should be smoother. The last moment should be smooth with comfort to the family and even patient also. That time, the right time that giving the medication is important. Other one of the myth is the morphine also can cause a respiratory depression. That like the people has gone to the various dose that will be treated by the pain specialist. What is the dose he has to give that based on the pain intensity, duration of control. They try to decide the dose, all those things. What are the pain specialist and near oncologist? They try to tell the dose. Please try to go for that. Don't think that like no, like if you take that as overdose, it is like those things. Try to discuss with the medical specialist. They are the right people and pain specialist. He try to tell that. Okay, this is one of the myth that additional thing. I think Bharat has covered most of the things. I had a few things, and I think other colleagues also might add up any any other.
Yes. Thank you, Dr. Satheesh. Moving over, Dr. Jatin, if you'd like to add something to the ongoing conversation, please, about the common myths that we see nowadays, please, sir.
Well, as Dr. Bharat rightly pointed out, that region-wise, there are certain myths, which are very, very specific. And the one myth which was rightly pointed out to him, that if you do a biopsy or if you put in a needle, the disease will spread. So this is the most important myth and the most frustrating myth we have to deal with each and every day. No, the biopsy is very important for subtyping of breast cancer. And in case of spread out disease, that is stage 4 disease or metastatic disease, the subtype makes a hell lot of difference with the kind of time period and the quality of life we can give to the patient. Sometimes, when the cancer has spread, the patients become really dejected and they stop taking any treatment, that there is no cure for them or anything. Definitely, in majority of cases, there is no cure, but there are certain cases, especially in subtypes which are hormone positive, you can have such a long and prolonged control, and that too with oral targeted agents and hormonal treatment, not even chemotherapy. And the other important myth that we encounter is while we start treatment of breast cancer with chemotherapy. First, the patient is really scared of chemotherapy. There are so many myths surrounding chemotherapy that people feel that their life will be hell. It's better off without chemotherapy than to go for a chemotherapy. And that's why sometimes in some subtypes we need to give upfront chemotherapy and then go for surgery. People tend to sometimes say ki, no, just do this, get rid of it, I'll go for surgery and won't go for chemotherapy. And so proper treatment is not taken. And so people have their own ideas because see, in breast cancer newer things come up every time, and what they have heard from their previous generation, they start their thought process is on the same lines, that if you operate me, then I'll be cured. If you are not operating me early, I won't be cured. So that's a big sometimes myth I have to or most of us will be dealing with in their day to day practice. And I would only tell the patients that please have faith on the practitioner, that whatever best is there for them, they should follow that. And the other important myth sometimes the patient gets in their mind is when the patient is treated, they stop coming for follow up. So that is another problematic thing. Follow up should be stressed in all subtypes. Very important, and even the good subtypes had to be followed up much longer because there are late recurrences in that, and people sometimes stop eating their hormonal treatment or stop taking their hormonal treatment, so the compliance gets affected, that everything is now done. I have eaten certain times, the 1 or 2 years of treatment, now it's over for me. So that is another problem.
All right. Thank you. Thank you, Dr. Jatin, for adding to the ongoing conversation. Moving over, Dr. Pradeep, two-part question for you. First, if you'd like to add anything to the common myths that you would also like to bust. And second, I would like you to, express your points on how do we combat the stigma that comes with a breast cancer, and how do you feel we can create a supportive environment for the affected individuals and their families. Over to you, please.
Good. So I would like to really add to what everybody has said. And see, the most important thing which we see in our practice, and everybody will agree with me, the patient comes to us. Okay, we tell her she has cancer, and we also tell her that she needs to take chemotherapy or surgery or radiotherapy and all these things. And with that, we also explain them that these will be the probable side effects, or she may lose her breast, or she may have to undergo the risks of surgery. So sometimes what happens is the patient then seeks alternative therapies. Okay, so she defaults treatment. She goes to any kind, don't want to name, but she seeks alternative medicine treatment, and then what happens is she allows the cancer to grow. Okay, so she has lost valuable time, where the window period where we could have actually cured her. So she may come back after 3 months or 6 months, or maybe after 1 year. Now with a stage of the disease which has completely spread outside the breast, and we are not able to cure. So this is sometimes very common, which we see in our practice. So I want to bust one myth today. There is no alternative therapy which has proven to cure breast cancer. Whatever we are practicing is standard evidence-based therapy, and this is the only chance with which we will be able to cure the cancer. Because we tell the percentage, like Dr. Bharath said, 60%, 80%, 90%, but we never say 100%. So that is our major disadvantage. Usually what happens is, in alternative therapies they promise 100% cure, and that is why the patient is attracted. So I warn all the patients not to fall for these things. Always consult a good oncologist, okay, and take a proper advice, and not to waste valuable time or window period where we are actually able to cure the disease. Okay, because breast cancer is such a disease, if it is detected in a very early stage, okay, then we can treat the patient completely or cure the cancer completely with as minimal treatment as possible. And I can say that this disease can be even less dangerous than hypertension or diabetes, where they require lifelong treatment, and this patient is no longer a patient, and she won't require lifelong treatment. That is one important thing which everybody needs to understand. Secondly, the common stigma which you said. Okay, so what I felt in my practice or experience is, so the more we spend time with the patient when she comes, okay, not only about the disease history, but what she is facing, financially, or her family history or family issues. So if you are able to probe a little more into that, the patient feels more comfortable and she will have more faith and confidence in the doctor. And secondly, usually the patient will get a lot of support during treatment. Means during treatment, everybody will take her to the hospital. They will ask her how she is doing, are you okay or not okay. But once the treatment is completed, then probably everybody will go their own way, whoever is giving support, and she may feel very lonely. And that is also a time when she can develop these kind of depression or psychiatric disturbances, or she may feel left alone completely. So the thing is, so there is always a thing called quality of life assessment, so which as oncologist I think we should do in a regular practice during treatment and after treatment, and assess if she is really facing such kind of problems, so that we can address them easily.
Thank you.
Thank
Thank you, Dr. Pradeep. So, as we are moving towards the last part of this session, my bonus question for Dr. Bharath. Uh, what I'd like to ask you is tell us about some key aspects of survivorship care of let's say, long-term individuals who have completed breast cancer treatment, and how can we encourage the long-term follow-up for such patients?
Um, See, there are three aspects to this. One is the long term medical. There is always a follow up stage 4 breast cancer. I'm talking about the women who have been treated with an intention to cure. We have declared that their breast cancer is in remission and we want them on follow up. So, there is a medical pathway for this. The most recommended medical pathway is that they get an annual mammogram, which is the only investigation recommended. There will be other centers which include more diligent testing with imaging of the chest and the abdomen with a X-ray, ultrasound, or a CT scan. These are done, but the recommended guideline is an annual mammogram. For the initial 2 to 3 years, it is ideal that they visit the doctor at least once in 3 to 4 months. After the second year or after the third year, they could visit the doctor once in 6 months. And after the fifth year, they can visit the doctor once in a year with the annual mammogram going on. Additional investigations are not recommended, but it really depends on the individual patient and the individual doctor, a conversation between them to decide on what sort of imaging that they need to get done. Now, this is the follow-up for the cancer. Now, depending on the type of cancer, for example, if it's a hormone positive breast cancer, the hormone may go on for 5, 7, or even up to 10 years. And if it's going on, there would be other additional treatment modalities on follow-up, like a bone-directed modality where, we give drugs, especially in postmenopausal women, to maintain the strength in their bones, to maintain the calcium in their bones, to prevent any fractures. So we would be giving them calcium, vitamin D supplements, and certain drugs called bisphosphonates or rank ligand inhibitors called denosumab to strengthen their bones along with the hormones. So that is a part of the medical follow-up and follow-up for the breast cancer per se. The women with genetic mutations may have a more diligent follow-up, MRI scan once in 6 months, alternating with a good digital mammogram, and maybe screening for other cancers like ovarian cancers. So we will have a specific protocol for women who have a predisposition, who have got the BRCA1 or the BRCA2, BRCA1 and 2 genetic. Now, other than this, we have got problems because of the chemotherapy, radiation which have been done, surgery which has been done. The follow-up will include many of the women have shoulder problems, armpit armpit paresthesias, lymphedema, that is swelling of the side where the surgery has been done. So they will need exercises, regular sort of reinforcements to continue these exercises to prevent lymphedema, to keep on reinforcing that they're not supposed to get injections or IV lines in that hand, or interventions in that upper limb, and continue with their exercises. So that is one part for the surgical follow-up and for the radiation follow-up. And then after chemotherapy, there could be women who have received anthracycline could have slight, rarely some problems with their cardiac function, so that has to be monitored. If you are on certain hormone drugs, you may have to monitor the bone health, like I told you before, for preventing fractures or assessing the bone health, and taking appropriate measures. You'll have to assess the cholesterols and take appropriate measures if you're on certain hormone agents like aromatase inhibitors. So this is cardiac health, bone health, cholesterol, all that has to be assessed. Now these are on follow up, and which drugs have caused these problems, so we follow that up. There are some problems like patients sometimes have neuropathies, which may need a lot of counseling, some amount of occupational and physical therapy, and reassurance, and sometimes a little bit of acceptance. Some women have little bit of a chemo fog, or a chemotherapy induced slight decline in cognitive functions. All these things may need physiotherapy and occupational therapy to rehabilitate them. So these are post operative issues. And then finally social. Already I think Dr. Pradeep mentioned that, or Dr. Satheesh also mentioned, that is integration. Dr. Pradeep mentioned, once the surgery treatment is done, then the social support falls. So we need to have social support groups of women with similar problems, where they meet, they discuss, they enjoy, and they continue to celebrate their life. They continue to celebrate their journey through cancer treatment, and they continue to celebrate their victory over their disease, and continue to uh, encourage the next patient also to go through. So it is like they pay it forward, they encourage the other woman. So there is a lot of follow up, the medical follow up and the social follow up, definitely the psychological follow up also. And I've not covered everything. I'm sure there are a lot of things more that are needed to be said.
Thank you, Dr. Bharath, for this well summed up answer. And as we move towards closing this virtual session, I'd like to put forward one last question to each one of my panelists here. And to start with, let's start with Dr. Satheesh. My last question for this panel is a message that you would like to share to all the viewers who are viewing, all the caregivers, or all the let's say breast cancer survivors, or maybe anyone from who's suffering in their families, a particular message that you would like to give to everyone on this breast cancer awareness occasion that we are doing. Please, sir. Dr. Satheesh.
Okay, thank you, Nishant. Regarding see, one thing is a lot of things where like I think 1 hour we are listening from everyone. A lot of things is not easy. Like yeah, one thing message I want to give is like every woman should know what is normal for them, the breast, and they should take care of. It's not like all the time I'll have a breast cancer. They're supposed to know what is normal best for them, and they have to have a emphasis on the self-examination of breast and right time the screening that I think my colleagues has told about the screening we should go not like the doctor also should aware of that. Okay, like a patient is insisting, like a patient is coming for that, when there any opportunity, any complaint they're coming, the doctor also should, okay, they have an examination of breast they're supposed to do from medical. It is a lesson for us also. Like oncologist will do it, but the general veterinary doctor, veterinary, they should aware of that. Okay, that any complaint they're coming, they are supposed to have the breast examination also. General public, that woman like that normal health of the breast and the self examination screening, you should not scared like no, if I get a screening I'll get a detect a diagnosis of cancer. This is scary, like this fear only is making many people that don't go for a screening. I used to see that 10 years back, like most of the time it should be third stage or fourth stage. Now I can see almost roughly around 40-50% of you like stage 1 or stage 2. That is because like many like because of the social media, education and IT people are like they're all aware of this. Okay, that a master health checkup, this has helped actually. The at least their package, at least they're getting this test, because of this they're able to find the early breast cancer. This is one message I want to give, that screening you please go. And the regarding the treatment for last one is, it is a please seek the medical professional help. Don't try to go divert, jump into the, because of the side effect profile, going for alternative therapy should be avoided. Go what is the standard recommended treatment. You have that a doubt, okay, the side effect is there. You have a proper education from the doctor. Like try to educate you all those things. try to give a best support treatment. That is the most important. It is not a one person now. It is a combination of doctors are taking a decision. Maybe some challenges. They not like all are normal. They may have some comorbidity, age factor, cardiac, renal function. Based on that, custom-made treatment will be given by a medical group of expert. They try to do it. Don't take a decision by yourself. Please take a medical expert. They'll give the right treatment from the best local available institution. And please try to aware of that follow-up is a very key important. Now my treatment is over. The people are side effect hormone treatment. They're putting on weight. That's why they're scared of would continue to treatment. And someone has told it's cause of bone weakness. I think Bharat has pointed out, okay, there are the doctor, like you have a regular follow-up, they try to identify what a risk of developing some side effect. They'll try give the supplement for that and follow up and what are some the required test will be they'll try to recommend actually because the people are scared to like if mammography is painful. Okay, yearly I have to go. Mammography is causing painful. That's why I don't want to go. They don't go to the doctor also. Please don't do that. Please try to do this what is recommended and the alternative please like just keep away. That's what is not like I'm not telling you that what is medically accepted you please follow that that's what take care of that educate your friends anybody is there at least you help them this kind of problem is there at least you can guide that is the one thing cancer survey like breast pink hope is there in our HCG that those are suffered and family because there are fertility issue also like doctor should be taken care younger woman they wanted to complete it they may be married they not have a children but please take a help of the doctor they'll try to guide you like okay what is the right age when you are on hormone therapy when you are to become pregnant all those things without taking medical advice don't go yourself okay suddenly I become a pregnant without a knowledge of the doctor all those things it may have an impact on the what the drug is going through all those things please take advice from the medical doctor they try to help you to in the right time when to go for the decision what kind of decision they'll give option it may be something because of cost factor many people they try to uh, drop the treatment at least the minimum basic treatment is required at least they try to tell us because of the cost factor when comes in a target therapy don't think that at least that is not affordable is the issue at least a customer made for the treatment for the each individual will be decided by the medical specialist they'll try to decide I think that I try to cover as much as possible thank you
Thank you, Dr. Satheesh. Dr. Jatin, your parting message for everyone that you'd like to say on this breast cancer awareness, please.
Well, I would like to say just one line that breast cancer is preventable, treatable, and one of the most curable cancers among the many different kind of cancers we get. And as far as the cost, as Dr. Satish said, in India, the cost of treatment is coming down drastically, and it is much less costlier than the people spend their money on or waste their money on alternative therapies or alternative treatment. Please channel your finances to the standard treatment, and yes, there is always a way out of this disease. Thank you.
Thank you, Dr. Jatin. Dr. Pradeep, your parting words and parting messages for all of our viewer, please.
Yeah, I think yeah, all my colleagues have already mentioned everything. The only thing I can say is once the disease is completely cured, she is no longer a patient. She is a normal woman like anybody else. So please remember that it's not like she's a cancer patient. Yeah, she's a cancer patient. She had cancer. There's nothing like that. She's just a normal woman like anybody else. So I want everybody to remember the same.
Thank you, Dr. Pradeep. And lastly, Dr. Bharath, your message and a parting awareness thing for everyone on this breast cancer awareness day, please.
Everybody has said everything. Be breast aware. What I would tell women and even the men is that, be breast aware. If you have any doubts, go to the medical professional and get yourself evaluated. Follow proper medical advice, and you can always get many opinions, but you will have to trust the system, you'll have to trust someone and get the proper treatment going. Don't keep postponing and procrastinating. Get the treatment going. Don't be afraid. There are a lot of women like you who would give you support, advice, and you have got a lot of patient support groups even in India. And lastly, cost should not curtail your treatment of breast cancer, especially early breast cancer. Today, excellent services are available in India at very low cost, and many times even free of cost services in many of the government colleges, in many of the government hospitals. Standard of care which is available anywhere across the globe in the best centers in the Western Europe or in Western Europe or US is available free of cost in many government centers, many government hospitals, and cost should not stop you from getting treated, especially treatment for early breast cancer, where we can, where we have a large population of women who can be cured. Thank you.
Thank you, Dr. Bharath. So with this, I'd like to bring this session to a closure. I'd like to thank our powering partner, Pfizer, for taking a step and an initiative with us. And I would like to thank my esteemed panelists, Dr. Bharath, Dr. Satheesh, Dr. Jatin, and Dr. Pradeep, for sparing a time out in helping Voice of Healthcare curate this event, curate this campaign where we could create awareness around breast cancer. I'd like to thank each one of you. And I'd also like to thank all the viewers who have engaged with us and spent time in listening to these esteemed people. So thank you and have a good evening, everyone.
Thank you. Thank you.
Thank you.